NBC 15's Justin Moore joins us live to explain why there's so much distrust with the vaccines that could end the pandemic. Justin?
Well, Andrea, doctors say that distrust is deeply rooted in decades of unethical medical studies on black people. Now, one of those studies was done right here in Alabama.
At this present moment, I will not be taking the vaccine. I do not have a desire to take the vaccine.
Jazuri D. McKinnon says he doesn't trust the science behind the COVID vaccines.
The vaccine is something that is used to biochemically completely change your genetic composition.
He's not alone. According to Pew Research, around 57% of African Americans do not plan to get vaccinated. Many don't trust the federal government after decades of medical studies on black people, including the Tuskegee experiment. It was designed to study untreated syphilis in hundreds of black men without their consent.
This vaccine, I'm kind of hesitant.
Others are hesitant because of the remarkable turnaround of the drugs. Dr. Scott Chavers with Mobile County Health Department says the science was already in place. Blacks and Latinos are 2 to 3 times more likely to die from the coronavirus than any other group. Health experts are relying on preachers and healthcare professionals like Charles White to make the community feel comfortable with taking the vaccine.
I just think it's got to be, again, our leaders and our people speaking up and even just letting them know that, hey, it's safe. It's not a conspiracy. It's a drug that save lives.
McKinnon says no one knows the long-term impacts of the vaccine and fears this could be another Tuskegee.
Y'all use the black person, the black face, in order to basically lure in the sheep.
Now, it's not just black people who are skeptical about these vaccines. The Pew study also showed that Latinos and whites in rural communities are less likely to get vaccinated as well. In Mobile, Justin Moore, NBC 15 News.